Hi, everyone. My name is Stephanie Bultema. I'm the Director of Research and Network Science in the Population Health Innovation Lab, or PHIL, which is a program of the Public Health Institute. I'm also a PhD candidate in Public Affairs at the University of Colorado, Denver. And today, what I would like to do is to share with you all some research that I am just about to present at the American Public Health Association annual conference. It's October 2021, and this research is being shared in the Community Health Planning and Policy Development section. The idea here is that we in PHIL recognize that not everyone may be able to attend the APHA conference, either in person or virtually, but we don't want that to be a barrier for you all to access emerging research. And so our hope is that by recording this presentation and making it accessible to you all freely and virtually, that you can learn with us as we're sharing emerging findings out from the larger Aligning Systems for Health research being conducted by PHIL. So in this recording, I'm sharing with you all the results from a smaller study within this broader research called Multisector Collaboratives are key players in improving community health during the COVID-19 pandemic, a multi-state mixed method study. This research was conducted by me along with the amazing research team at PHIL, who you see listed here at the bottom of the slide. I also want to just give a huge thanks to our funders at the Georgia Health Policy Center and the Robert Wood Johnson Foundation, who are supporting this research and related research in our Aligning Systems for Health project through their National Aligning Systems for Health initiative. And I also want to give a huge shout out to the countless individuals and organizations who have made this research possible. Key among those, the 22 ACHs across Washington and California who have worked hand in hand with us throughout this research project. So the research questions we'll be exploring today are: how have multi-sector collaboratives, or MSCs, contributed to pandemic recovery and response? And what are the characteristics that best predict the extent to which an MSC strengthened its community's ability to respond to COVID-19 and its consequences? The overall conclusion of this study is that MSCs can align cross-sector efforts and connect communities with needed resources that strengthen emergency response and resilience. The hope is that after viewing this presentation, you will be able to describe 3 ways that MSCs strengthened community response and recovery during the COVID-19 pandemic, and that you'll be able to discuss the characteristics of MSCs that are best predictors of their ability to contribute strong community support for pandemic resilience. So let's start by getting on the same page about this term, multi-sector collaboratives, or MSCs. MSCs are essentially interorganizational networks that bring together diverse stakeholders around a shared purpose. Now, there are 2 key elements that make multi-sector collaboratives a little different than any given interorganizational network. These include, first, that the MSC includes multiple sectors in their work. And second, that these representatives or these partners, they act collaboratively, meaning that they are at the table and contributing in a meaningful way and of their own accord. Now, through this research, we've seen that health-focused MSCs, specifically one type of health-focused MSC called Accountable Communities of or for Health, also referred to as ACHs, which you'll see me refer to a little bit throughout this presentation, that these health-focused MSCs played a critical role in COVID-19 recovery and response. And ultimately, we saw that MSCs leveraged their existing networks to support communities during the pandemic. And so this is what we'll be exploring today. Now for a quick overview of methods. The sample included in the study are 22 health-focused MSCs, more specifically ACHs in Washington and California. There are 9 in Washington and 13 in California that are represented in some way in the study. 642 unique individuals contributed their knowledge and insights to the study, many of whom we engaged with more than once throughout this study. Data are derived from interviews and focus groups, survey responses, and archival records. And analysis uses descriptive statistics, multiple regression, classical content analysis, and constant comparison analysis. When we look at who is represented in the study, we see that at the group level, representatives of the social services sector and healthcare sector are most represented in this study. We see that there is about equal distribution between individuals who are living in the urban, suburban, and rural areas. And that results are most representative of people who identify as white and non-Hispanic or Latino. Now, starting off with a very high level result related to the overall study. We see that the majority of survey takers, 77%, said that their MSC strengthened their community's ability to respond to COVID-19 and its consequences to a moderate or a great extent. So now let's take a deeper look at how did they do this? How are MSCs contributing to pandemic recovery and response? First, we've seen that MSCs have stepped up and really supported health departments in numerous ways. First, they've helped immensely with distribution of personal protective equipment. We see here on the right-hand side a quote from an ACH staff person in Washington who said that as a member of the ACH staff, I'm assisting with distributing 3 million masks in our region. We just hit our 2 million mark today, meaning we have distributed 2 million masks to the region because of the ACH. We also saw that MSCs supported their health departments through disseminating information, especially to harder to reach communities, such as small CBOs serving historically marginalized communities and far-reaching rural communities or tribal nations that may not be as easily reached by government entities. We also saw MSCs support health departments by providing accessible public education. And so many MSCs stepped up and helped to translate educational materials into multiple languages to ensure that everyone had access to the same information. And we also saw these MSCs modeling best practices for their communities, thereby helping to create a culture of health, even during the pandemic. Next, we've seen that MSCs played a critical role in connecting partners with resources. This could be resources in the way of funding, whether it be through the MSC itself, where they would redirect funding of their own to create funding opportunities for their community, oftentimes in the shape of small grants. Or we also saw that many MSCs helped to ensure that their community was aware of funding opportunities offered by other agencies to support during the COVID-19 pandemic. We saw that MSCs developed and helped to share out tools and resources that were developed by other partners. On the left-hand side here, you see an example These are door knockers that were created by one ACH and distributed broadly throughout the community with the goal of helping to create social cohesion in a community during the time when many were self-isolating. We also saw that MSCs were either themselves providing training and learning opportunities or helping to connect their partners with these opportunities. Next, we saw that these MSCs were vital for coordinating community-wide response efforts. They did this in numerous ways, whether it be through leading care coordination efforts, helping to develop or improve upon referral systems, helping to host or support testing sites. And also, they hosted virtual provider meetings. And so in this way, helped providers to stay connected across clinics and across practice areas. And finally, they help to ensure information across their collaborative broadly to ensure that everyone had access to relevant and timely information about the pandemic. We heard from one healthcare representative in California who said that I find it extremely valuable to have all the community partners at the same table with a shared vision. The work of this collaborative around housing and the opioid epidemic, which are linked to COVID-19, has been powerful. Finally, we've seen that MSCs were really important in supporting the remote transition. They did this in numerous ways, one of which being helping to advocate for and support the transition of providers to using telehealth. We also saw MSCs advocating for rural internet access and generally internet access for everyone so that everyone could stay engaged throughout the time of social isolation. We saw MSCs being leaders in moving to virtual meetings and also helping their partners understand how to navigate the virtual space. And finally, we saw MSCs developing web-based resources and sharing out web-based resources with their partners. We heard from one business representative in Washington that the ACH has been a wonderful source of information and support during the pandemic. So next, we're curious to look at the survey data a bit more deeply. Now, this survey includes responses from all types of representatives who are engaged in this health-focused MSC work in some way. And the survey included questions about collaboration dynamics within the ACH and how these collaboration dynamics contribute to achieving outcomes. So we were interested in seeing which of these collaboration dynamics are related to, or more specifically, positive predictors of the extent to which an MSC strengthened its community's ability to respond to COVID-19 and its consequences. And we found 3 top predictors of this outcome. The first has to do with effectiveness. So we saw the top positive predictor being perceptions about the extent to which survey respondents believed that as a whole, the MSC gets things done. Next, we saw an important positive predictor being that the MSC helps community, clinical, and tribal partners work together more effectively. And finally, we saw that individual or group engagement was really important, so that as a group's engagement increased in the MSC, they also reported more positive perceptions of the MSC's contribution to COVID-19 recovery and response. So in conclusion, we've seen that ACHs in particular, but really MSCs across the board in this kind of interorganizational collaborative space, that these MSCs aligned cross-sector efforts and connected communities with needed resources that strengthened community ability to respond to COVID-19 and its consequences. And the public health implication of this conclusion is that MSCs should really be included in emergency preparedness planning, since they are evidently critical players in emergency response. Thank you all so much for your interest in Phil's emerging aligning systems for health research. We will continue to be sharing research out with you as it is produced and trying to make it as accessible for you all as possible. If you have any questions about this presentation or Phil's aligning systems for health research more generally, please feel free to reach out to me directly at the email listed on this page. And I would also encourage you to check out Phil's website for a plethora of resources and tools that are freely and openly available to all. Thank you all so very much. I hope that you are well in whatever you are doing today. Thank you.